Hi, this is Take Charge Your Health with Corinne Furnari, clinical nutritionist, physician assistant, and Carol Petersen, pharmacist. Listen, learn, and I hope you enjoy the show. Bye.
Welcome back. This is Take Charge of Your Health with Corinne Furnari, clinical nutritionist and physician assistant, and my co-host, Carol Petersen, pharmacist. Every week, we present you with new and creative ways to help you make sense of health information and bring it home to you and your family. With years of clinical experience between us and research into traditional and cutting-edge technologies, we give you practical information to help you take charge of your health. Well, welcome back. Today we have a very special show, and I do believe most of you will not really know about it. As a matter of fact, many of our healthcare professionals don't really understand this. It was Carol's idea. Hi, Carol.
Hi, Corinne. How are you today?
I'm
How's
good.
everybody out there?
Absolutely terrific. And how about you? It's just a beautiful day.
Yeah.
One of
Well,
those days that makes you feel happy you're alive.
okay. Are you going to reveal the word of the day?
The word of the day. Yes, definitely. Thank you. It's histamine. Histamine, and I'll give it two words, intolerance. Well, what is histamine? Well, guess what? Carol brought this up, and I said, oh, well, I understand all that. Yeah, sure. So I looked it up, and come to find out, I wasn't correct. I was mistaken. I had a relationship of histamine to the body mixed up with allergies. And many of us do. Many of us do. So do many doctors. So let's talk about what is histamine. And then I'm going to pass it to Carol. What is histamine? Histamine is a compound. It's produced by the immune system, specifically mast cells and basophils, that act as an inflammatory mediator. It plays a crucial role in immune response, but an excess can lead to various symptoms, and it also functions as a neurotransmitter in the brain. I didn't understand that. So, Carol, I'm going to pass it to you, and then you can pass it back. Carol? Well,
Yeah, well, it seemed like Carol, for some reason, has dropped out in the connection. So I guess you have to take it from there, Corinne.
no problem. I can do it. I miss her, but I can do it. Thank you, Reggie. So,
Can you hear me? It looks like I'm
now
on.
we can.
Okay. Looks like I'm on. Okay, good. I wanted to say it's such a confusing topic. I know somewhere I have this book by a Russian doctor who actually used histamine therapeutically. And you would think, like, no, 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 we have too much histamine. We don't want all that
Hmm.
histamine, right? And that's part of the
And in
picture.
some cases, that's right.
In some cases, that's right. You need a little. So I think we're probably going to spend most of our time on the discomfort of too much histamine rather than the lack of histamine, which is a whole nother story. And how do you know this is a problem? Well, guess how I came to realize this was a problem. I love progesterone, right? I love to talk about
Oh,
progesterone
really?
day and night. And I have this little habit about checking out what the relationship of progesterone is to something. And we started seeing things like mast cell activation syndrome, MCAS. You've seen that now, right?
Yes.
Where did it come from? We never used to call anything that. All of a sudden it came into my awareness. It's here, it's there. There's groups, there's Facebook groups. Everybody's talking about it. So I typed in Google and I typed in mast cell activation syndrome and progesterone. And to my amazement, I learned that the whole hormone cascade that we really usually associate with organs, the adrenals, the ovaries, testes, that whole thing is going on inside those little mast cells. Isn't that amazing?
I,
And
I, I got something here to support your thesis. I stole it from the internet, and it's right here.
yeah, and what's really cool is so it kind of illustrates in the first part of the menstrual cycle. That's not quite true because you do have more progesterone, but you do have more estrogen than normally. And if you are out of balance inside that mast cell, that causes degranulation, is the medical term, but it causes histamine to dump. And then progesterone, when you have enough progesterone, it prevents that imbalance. So this is kind of something very, very interesting because we think, oh, progesterone is balancing the ovarian hormones, but it actually is also balancing intracellular stuff.
But
And there's other places like your brain and your nerve cells that do the same thing, produce hormones up there. And if you use extra progesterone, it actually makes a difference.
it makes a difference by stabilizing the mast cells so they don't burst and release all the histamine. Histamine is an inflammatory. Histamine has a wide ranging effects that are due to the interactions, and there are 4 types of histamine, although we're going to talk about 2 today, H1 and H2, and the common symptoms that we see from H1 and H2 excess has to do with insomnia, anxiety, headaches, migraines, dizziness, tinnitus, irritability, fatigue. I'm going to GI symptoms, acid reflux, heartburn, bloating, abdominal pain, diarrhea, nausea, respiratory symptoms, sneezing. We all know that sneezing, nasal, sinus, dripping, congestion, runny nose, wheezing, and difficulty breathing. And then skin. How many of us just have uncontrolled itching at certain times? Rashes, hives, flushing, swelling, cardiovascular, palpitations. Here we're talking about hormones, and we're looking at palpitations, which are really common
Very much,
postmenopausal
or
and
perimenopause, starting in
and
peri.
when you have elevated estrogens, rapid heart rate, another symptom of elevated estrogens or imbalanced estrogens, high blood pressure, low blood pressure, and then hormonal dysmenorrhea, pain with periods, severe pain, and and it's interesting how those symptoms are throughout the entire body. There's not one little area that says histamine. That's where the confusion comes in. Carol?
Well, it is confusing. I had to look this up myself
Oh,
because
now I feel better.
okay. Well, we have all this lab testing. How do we tell if you have a problem with histamine? Can you test it with a lab? And I had some clients who went to a very famous clinic in Switzerland, the Paracelsus Clinic. I bet you've heard of it, Corinne. Maybe you've been there in your travels. And after they came back, they got an email and said, "Here's the test." She tested for having exceptionally high histamine, and I said, "So how did they test it?" Well, she had 2 tests for it. One was a blood test that they checked for DAO. DAO is an enzyme that metabolizes histamine. So if your blood test comes up low with
Low.
DAO, ipso
That
facto, you have high histamine. And the other thing was she got an IgE test that showed she had exceptional histamine activity. There's a couple other tests, skin prick tests and whatnot, but we don't really routinely do these kind of tests. So just as you were saying in your introduction, Corinne, doctors don't usually look for it or think about it or
because
know
they
about it. Um,
exactly because they
so
can't identify it because we don't have adequate testing. When I was looking up things to do this show, one of the things that they had outlined was that there is no blood or urine test that is adequate for testing histamine intolerance, and that the only real test is an elimination diet. And they said, so if you're having symptoms, itching or the menopausal doubled over or the palpitations or the tinnitus, if you go on a water fast for 24 hours and the symptoms go away, you have your diagnosis. So, and then there's a treatment that lasts a couple of weeks. It is not something that is not curable, but it's not able to be dealt with if it's not diagnosed.
that's right. You can. I like to explain it. So back to my favorite hormone, progesterone. Progesterone is very effective because it actually will affect the mast cells and balance off that estrogen dominance. So you won't have the big dump of histamine in the first place. All well and good. Exogenous progesterone that you use in addition to your own if you're having this problem, will give you some relief. It actually will stop it. However, what if you miss that opportunity and you have a whole bunch of histamine dumped? What to do then? That's a bigger question. And progesterone can help in part. It does help make more DAO enzyme. Interesting enough. I'm not sure how well it does it, but it has a little piece to play in there.
It
But
does two things. It makes more DAO enzyme, but it also slows down, it stabilizes the membrane, so it slows down the release of the histamine. So you have a double effect that's very powerful. And it has, but it can only work with cofactors. If these cofactors aren't present, you're not going to be able to get the DAO enzyme to respond. And that's adequate B6. That's an activated B6. It's vitamin C, it's copper, and it's zinc. Without those in adequate levels, or levels that are appropriate and necessary for the body to function, you're not going to get the correct response out of the DAO enzyme. And there's also something else. The gut can interfere also, in that the gut, depending on the type of microbiome, the gut can eat the DAO enzyme. So there are certain probiotics that can work very well in terms of blocking the probiotics that are blocking the DAO enzyme. We'll get to those in a little bit.
while you're mentioning the probiotics, one should be very careful. I haven't looked up each individual one, but there are organisms that actually produce histamine and organisms that don't. So if you had an overwhelming amount of a particular strain that's also producing histamine, now you have another problem.
Yes,
Not,
yes, and so that's why I said we will bring up there are two strains that are specific for supporting histamine and making histamine more available and making histamine less available.
yep.
And one of them, I'm just pulling it up right now, one of them is Bifidobacterium. And you can see that on strains of probiotics, Bifidobacterium. And the other one is one we talk about all the time. And I didn't know until I looked this up how powerful this was in this field. And that's Saccharomyces boulardii. I constantly recommend Saccharomyces boulardii because it's so powerful and it has such a cleansing effect on the intestines. I recommend it regularly, but in short bursts, 1 month on, off,
Mhm.
1 month on, off, because it's so powerful. Well, guess what? It is so powerful because when we really look at it and we do the studies, we have to understand that it is assisting and cleaning up the bad bacteria that's blocking the correct action of the DAO enzyme.
So do you think we should open up the phone lines? I'm sure people have something
I
to say about this. It's a pervasive problem.
yes,
I,
it's a people think they're having allergies.
yeah.
They
So
think that they're
yeah.
having allergies, and what they really might be having is histamine intolerance. And histamine intolerance is very treatable. Okay, so the number to call 212 209 2877. That's 212 209 2877. Give us a call. Share your thoughts. I also found something very interesting, Carol. Two things related to this. In pregnancy, during pregnancy, many women lose all this allergic reaction, and it's gone all the way during the pregnancy. And what is it? What is happening? The DAO is increasing by 500% because the DAO is made by the placenta. Because the body doesn't want enzymes or processes in there that will interfere with the development of the fetus. So during pregnancy, you have an incredible increase in DAO, so the histamine is being broken down to not interfere with the development of the fetus. And then there's something else. When I was
Yes.
first in practice, I know all of this
Oh.
came up. Carol, you broke open
Good.
everything. What did you start?
Thanks.
When I was in practice, I heard about asthma, postmenopausal asthma in women. That it was not uncommon that after women or during menopause and postmenopause, women get asthma. What was it? Now I understand. I got it. It was histamine. It was histamine intolerance, where histamine was surging up in response to the suppression or reduction of progesterone, and therefore the imbalance of estrogen, which was stimulating this histamine reaction. So there.
So
See,
stunning.
see,
Well,
see what you created?
so
Two
I
one
went at,
two two zero
okay.
nine 2877. 212 209 2877. Go on, Carol.
Well, I uncovered another mystery. So
Yay.
I was thinking about this high histamine and progesterone helping stop the release, but after the release, we have DAO. I wanted to learn if there are any other things we can do to get rid of excess histamine. And I found it right away. And it's methylation. We've talked about methylation quite a bit on our show. It's one of the detox mechanisms. It helps you detoxify estrogens and adrenaline and now histamine. And I'm so excited. So the methylation, you can test for this with genetic tests. They'll let you know if you have a genetic propensity to methylate well or not methylate. I saw a test the other day, all kinds of pathways within the methylation complex can have issues or non-issues, but when you do, you have this dump of histamine and you can't get rid of it. So the DAO, yes, and now methylation. So what do you do for methylation? You supply methyl groups. So we are already talking about B6, but let's throw in the rest of the B complex, because the methylfolate, methyl B12, riboflavin, all of these are going to help you detoxify histamine. And I think that's an important part of this story. So who knows that? Like, you feel like you have an allergic reaction, you have runny nose or whatever, pain
or
in the stomach.
itching, or
Yeah.
pain, or
And so
reflux, or
you can go
insomnia.
you can go grab your B complex and get some relief. It's just incredible. On top of that, you're talking about what's happening in the microbiome. You can have disorder there with your bacteria in your gut. The healthy microbiome produces methylated B vitamins, and when you're not making that very well because of your gut, you're a step behind. That you can see a little clue to that if you have a serum test for B12 and you're on the lower end. B12 serum is not a good measure for B12 activity. But if you're really low, like on the low end 200s, 300s, it's a red flag that your microbiome's not participating. That B12 represents the microbiomes, what you eat, what you supplement. And so if you're in the tank, you really have to look at the gut as well as other sources of B12.
A little bit more on that histamine and methyltransferase enzyme. They're found, the largest preponderance of them is in the liver, in the lungs, and in the central nervous system. So if it's not working right, it's very possible that you're going to have neurologic symptoms, the anxiety and the palpitations. So it neutralizes histamine through methylation, acting as a methyl group to histamine to make histamine inactive in the body. So what do we use? We use SAMe, and we've known SAMe. It's a precursor. It's one of the steps on the way to homocysteine. But SAMe as a calmer, studies were done in Italy on 200 milligrams, and women were calmer and able to sleep better. B12, as Carol said, B6, and betaine. Some
Mhm.
digestive enzymes can be very, very.
Trimethylglycine is another name for betaine. Three methyl groups for your
Th-
detoxification.
212-209-2877. I can bet you that many of you have experienced this, been told, oh, you have allergies,
That's that's
and
the end of
that,
it.
yeah, that's the end of it. And it's not just allergies. It's not just that you eat. It's not that you just eat something like uh, oh my goodness, hello, that you eat something like shrimp and you have a reaction. It's that you're
Uh-huh.
reacting to everything. You feel like you're going crazy because you're reacting to everything. So I just got a text from someone in the um, in the studio that says that they've been put on a low histamine diet. So they're in the process of being healed of histamine intolerance. Once you do the histamine diet, you do it for a few weeks, even a month, the end result is that you can start adding back foods because the microbiome in your intestines starts changing, your whole body starts shifting, and you can start one by one, not too fast, adding back foods. It's a very exciting space to be, especially after you felt you were going crazy. You were reacting to everything, and everything was wrong, and you didn't know what to do. And when you do this diet and it all calms down, you can add back things, add one thing, and go slowly, and then maybe add another. But you can eat normally, even things that you thought you could never eat again.
Okay, what about
212 209 2877. Carol, go on.
one of our favorite things we like to recommend, fermented foods?
Well,
Wow.
that's a double-edged sword.
Good.
It's definitely a double-edged sword. It's not really something to start out with right away because it can aggravate the syndrome.
Yeah.
Guess what? Here, I think I'm going to eat a very good meal. I'm going to have yogurt and avocado. I'm going to also have some spinach. I'm going to have a spinach salad and maybe tomato and eggplant.
Oh.
All good foods. And guess what? I have this. Go on. What'll happen to me, Carol? Tell me.
I don't know. You might develop a big pain in your stomach, or your nose might run.
Or my nose might run, or
Uh-huh.
whatever the symptoms are might come. My personal symptoms might come back with vengeance or come out with vengeance until I begin this low histamine diet. Let me just read what a low histamine diet, let me read what you're really not supposed to eat. Wine, alcohol. Alcohol is high in histamine. Wine is high in histamine, but it also has another factor. So it's a factor. It's a double whammy. What happens is it's high in histamine and it suppresses through the action of the alcohol the DAO. So here you have a weakened DAO of what you have, and you have an increase in histamines. Vinegar, it's less active, and the best vinegar, if you're going to use one, would be apple cider. Aged cheese, very high in histamines. Cured meats, high in histamines. Avocado, oh my goodness.
Oh, one of my favorites.
Canned foods, and particularly canned fish.
Wait, Corinne, just 1 second. So we have a Facebook question, and the question is, what's the worst food for histamine? Do we have any idea?
Well, alcohol is very bad, but
With
it's not a
the double
food.
whammy. Yeah.
Spinach, eggplant can be pretty intense, and let me see. Soy is not good unless it's sprouted, and sometimes it can be okay when it's sprouted, but generally no. And
Wait a minute, don't we like the natto fermented soy and the fermented
not at this time.
the miso and the tempeh? We're supposed to like those.
Eventually, yes, but
That's
not
good.
at this time.
Okay.
Not at this time. I'm going to pass on that one. So we have those that are, but then there are foods that are really encouraged to eat, that you're encouraged to eat. And that's asparagus, bell peppers, blueberries, cabbage, cauliflower, grass-fed beef. It's very specific, grass-fed. green leafy vegetables other than spinach, turkey, white fish, not canned, green tea, liver, squash, zucchini. And there are some supplements that work very well also. Very well. And
Quercetin comes to mind.
it's
No?
amazing. It's one of the
But
best. Quercetin is one of the best for stabilizing the mast cells. And we use quercetin for multiple things. We use it for cancer. We use it for allergies. They have a quercetin spray that they use, inhaler, that literally can assist to block allergies when there's an asthma, exercise-induced asthma, and then there's this inhaler with sodium cromolyn and quercetin, and it can block that histamine reaction. So vitamin C.
vitamin C is a biggie.
Yes.
And I have often told people, and done it myself, increase my vitamin C if I had a runny nose. I don't know why I read that many years ago, but you can use some very large doses of vitamin C. It has so many intricate mechanisms here and helps with your adrenal glands, so it contributes to your adrenal stability. When you have all these allergies, you're probably exhausting your adrenal functioning and your cortisol and whatnot. Oh, what about that? People might get prednisone. Or I had a client yesterday for 20 years has used a steroid inhaler
Oh my
because his
goodness.
nose won't open. So we're
What?
using these anti-inflammatory drugs, but what's the underlying cause? The
Yeah,
histamine
that
kind of reaction.
they're not looking at the underlying cause, and more than that, what they're doing is they're suppressing the symptoms by suppressing the histamine receptor sites. And then what happens? What happens is that the body makes more histamine receptor sites, more and more and more. So when you stop taking the medicines, you have a rebound that's so intense. You say, this is worse than ever. I can't live like this. I have to be on the med. And that's true. They have to be on the meds. Let me finish with just some histamine natural support, and then let's talk about the histamine blockers, the medical ones. Vitamin C, stinging nettles. Stinging nettles has a double hit. One is that it blocks, it supports the DAO, and number two, it works in the liver to support and help the methylation. So it's got a double hit. It's very powerful. And stinging nettles has been used even to block anaphylactic shock. So bromelain. Now bromelain's interesting because bromelain is from pineapple, but pineapple is very high histamine. So, I would recommend taking the capsule rather than taking the rather than eating the pineapple. And then NAC, N-acetylcysteine, can be really powerful in terms of blocking the histamine reaction. So what about the medicines? What about what I remember someone came to my house, a young girl. Let me give a phone number: 212-209-2877. 212-209-2877. We'd love to hear from you. It would be absolutely wonderful. Give us a call. I know how many of you are on Claritin? How many of you are on Zyrtec?
Zyrtec.
So,
and Benadryl. You know, and
tell us, what are those, Claritin and Zyrtec?
Well, they're antihistamines, working mostly on the H1, and this is the receptor part that you get the nose stuff, and you get the itchy skin, and you get the hives, kind of what you think is an allergic reaction. And so you take these, and it blocks the activity, and you run the danger of your body's going to react and try to make more receptors because you're getting things blocked. And lo and behold, if you happen to stop it, it's even worse than when you started. It's ballooned way beyond belief. And you have to go back on. You think, I can't live without it, because if I try to stop, all my symptoms come back with a vengeance. So you're almost physically um, required to keep on going. So many times the antihistamine Benadryl is used as a sleep agent because it causes so much drowsiness. However, now they have warning signs on Benadryl about producing dementia, long term use of Benadryl. And it was considered a really good antihistamine. You could use it without
Use it every
danger
night and
for
you
every
sleep.
night for the rest of your life if you want to. And we've realized now it's not so safe. Kind of creepy.
There's an the that was the Claritin and Zyrtec are the H1 blockers, but
Right.
then there's an H2 blocker that we used to give for severe allergies when allergies couldn't be controlled. It's Pepsid. That's an H2 blocker.
Um,
And go on,
Tagamet,
Carol.
Tagamet, Zantac, H2 blockers. And this is a different, I did look up to see what kind of natural substance would work on the H2. And really only found two important things. One was peppermint should help, and our good
Nice
old vitamin,
peppermint tea.
yeah, and our good old vitamin C again
Oh my
cropped up.
goodness.
But there was very little else. And one, I think Tagamet's been taken off the market because of cancer concerns over long-term use. Again, people get into this practice of using an antihistamine drug, uh, and they have to take it all the time. And so the side effects accumulated, and you're in a pickle.
You know what else helps, Carol, is
What?
enzymes. And they can prevent some of the bloating. A number one symptom, very, very common, of elevated histamines, is bloating. So enzymes and reduce inflammation, they prevent bloating, they absorb and help you absorb the nutrients that your body needs to balance the mast cells. And they help you absorb and break down proteins, fats, and carbs and improve digestion. Now, there is, and I don't know if it exists right now, but there is a DAO enzyme,
It
which
does. You can
it
get it.
does.
Yep.
Okay, thank you. And you could get a direct DAO enzyme, and that would work directly on the mast cells and the elevated histamines. So that is very interesting. There's also herbals that you can use, and they're for SIBO, small intestine bowel
Bacterial overgrowth.
overgrowth.
Yeah.
Thank you.
You're welcome.
And dysbiosis and candida, and one of them is berberine. We talk about berberine all the time. It's such a wonderful herb, and it's very specific for the for the body, but
Yeah.
it really assists the intestines. Then we have organic oregano oil capsules, very strong, very powerful. And then guess what? Good old garlic.
Yep.
Allicin works tremendously as an intestinal anti-inflammatory, and consequently you get some very powerful relief when you take any one or all of the above, and then that's very good. There's another reason for this effect, and that's what they call leaky gut, where there's an inflammation in the intestines, and due to the inflammation in the intestines, there's like little gaps. The intestines have swollen and they're not holding together tight and guard.
This individual cells of your intestinal wall.
So you can do things for that also while you're healing. One is glutamine. Glutamine is powerful for healing and working with the intestinal wall and helping the body seal up that leaky gut. But then there's another one. It's called IgG, and the IgG it's immunoglobulins from colostrum from cows, but it's non-dairy. And when you're using these, you want to cut out refined sugar, you want to cut out gluten, you want to cut out dairy, alcohol, and vegetable oils. Very important vegetable oils. They're powerfully inflammatory. You want to avoid non-steroidal anti-inflammatories, and you want to manage your stress. It's a very interesting thing how stress can very directly relate to your intestines and your intestinal inflammation. I'm giving out the number. I know what's going to happen. Everybody's going to want to call in right at the end, because this is one dynamic and ubiquitous topic. I can't imagine that anybody has gone through and not experienced some of this at some time in their life. The number to call is 212-209-2877. And we're also on YouTube, so you could, if you're on the internet, you can type in a question. We'll be glad to answer this. And I really want to thank our YouTube listeners. This is our first bout with this, and we're really quite excited about it. We're opening this up for listeners and participants. Carol, how about ibuprofen? That works to bring down inflammation.
Okay, first caller is holding.
Oh my goodness. Hi. You're live. Your name, please?
James.
Could you please speak up a little?
James.
Hi, James.
Could you, when you do your show, could you list like the best books on the subject that you are talking about? Because people like to get a more in-depth idea of information.
Well, actually, what book would you like, Carol, to list?
I don't have one.
Nor do I. I did all this research on the internet. I got the word and typed it in and started looking up studies. I didn't really have a book. But
That's
then
really interesting. I can't think of a single one, and usually somebody's peeled this off as an important topic.
Well, in the times when you do have some good books, would you list them?
We would be glad to.
Thank you.
A pleasure. Thank you.
Corinne, you can write it. We'll have it ready in a year or 2, 3 years.
Okay, co-author Carol.
Yeah. I'm shocked because there are so many authors out there. I bet there is
intestines. On the intestines and the brain.
Another piece of this is go to youtube.com and take charge of your health radio on YouTube Live. We're live on YouTube right now.
And
I also was listening
also,
to there's some people have problems not only with the histamine has messed up the gut, but they have trouble digesting complex carbohydrates and have to do a FODMAP type diet or a disaccharide, a 2 sugar binding diet, which eliminates the sugars that are two sugar molecules together. So there's some very, very elegant. I know there's a book about the disaccharide issue. I'm trying to remember the author's name. It's an old book. Elaine something. It was it was kind of funny. My husband had a client, and she had actually a lot of problems with her connective tissue, and he said to her, "Oh, you should go on this disaccharide diet, and you'll probably be able to heal better. Let's give it a try." Elaine Gottschalk. Does that
Elaine
ring a
Gottschalk,
Yeah, does that ring a
brilliant.
bell? So
Yes.
he gives her the book, and the woman's mother said, "Oh, I met Elaine Gottschalk. She said your dad had to go on that diet."
Well, it's a
It's
brilliant
really a
diet.
diet.
It's a brilliant diet. I had a patient who came in who a principal in the school, and he was scheduled for surgery for his colon, and they were literally going to remove parts of it because he was bleeding so heavily and having so
Oh,
many problems, and he wasn't able to eat. So I literally gave him my copy of the book, and I asked him to follow this diet, at which time he complained. And needless to say, I stood up and said, well, let's see what we can do. If nothing happens, you're scheduled for surgery. So within a week and a half, his bleeding had stopped. And he continued to see me for about a month after that, and his bleeding maintained. Then he stopped seeing me, so I said, oh, well, it must have returned, and he went for the surgery. 8 months later, he contacted me, and he was still on the diet, and he had turned himself around. That's what happens many times with GI, is the healing can be very profound and powerful. The Elaine Gottschall, what was the book called?
the carbohydrate
Hydrate.
specific diet, I think.
Yes,
Yes?
or
Do I have it right?
not exactly, but it's
Not
close.
exactly.
But she was brilliant. She was a nurse from Canada who was working under a doctor who used this diet in his office. He died, and she wrote the book. And this book was passed around from person to person. It was we have a book for James.
Yes.
Elaine Gottschall. It's brilliant. You might have to go into the archives, but you can find it. It's
I'd like to
yeah.
jump back into the
Yes.
histamine. When you have high histamine, I only learned it this week. So you have this imbalance with estrogen dominance, dumping out histamine. And guess what? All that histamine has a pathway to make more estrogen. So we have one of these
it's
vicious
a circle.
the circle.
I love circles.
Circles. Well, this is not a very pleasant circle.
But their understanding is so profound.
Yes.
That's why I like them.
Yeah. So I'm normally recommending quite generous amounts of progesterone. But when you think that you need the progesterone to help balance that estrogen and the consequences of that imbalanced estrogen, there are too many practitioners being very stingy with their progesterone. Stingy. I will say stingy. It just, my clients tell me they go to their practitioner and They ask for more progesterone because probably they already tried it with what they had and felt much better. Or they'll say, oh, my practitioner doesn't feel comfortable using more than 200 milligrams of progesterone. Yet at the same time, they'd love to give you antihistamines like hydroxyzine. I see women on that antihistamine type drug. They love to give you benzos to calm you down. You lose the calming effect of progesterone. They give you
which are
antidepressant,
addictive.
very addictive. So they're very comfortable giving you some very toxic solutions, and the thing that could restore your health and restore all these imbalances. So we have to contend with, when you give a little progesterone, you are trying to balance estrogens, and we can have lots of estrogens are in our body already, and we have lots of estrogenic type chemicals in our body. And then we have adrenaline needs progesterone to balance it. Histamine needs progesterone to balance it. You're asking a lot of that, a little bit of progesterone, and it simply won't work as well.
So guess what?
Oh, it's time.
It's time. This has been really fun. It's been fun participating with the YouTube audience and getting some questions. Our YouTube is Take Charge of Your Health Radio on YouTube. Take Charge of Your Health Radio on YouTube, and you can join in from 4 to 5. Also, I want to thank the listeners. It was really fun. I want to just name a few key points. Histamine intolerance has a wide range of symptoms. Aged and fermented foods can aggravate it. Lower DAO can be a cause of it. Low histamine diet can help, especially it begins the heal gut to restore the DAO, which will happen or can happen, and reintroduce your foods, and you're back in the ball game. So I want to thank you. I want to thank Reggie for helping us with this, and I want to thank Carol, and I want to thank the audience. Thank you, James, for calling in. And we will be back. Carol, oh, what is your website?
My website is a wellnessbydesignproject.com, and I have a YouTube page as well at that same name. And Corinne, and we have a Facebook page, also Take Charge of Your Health at with Corinne and Carol. So you can message us on our Facebook page if you'd like to. And your website,
And
Corinne?
there's one other thing, is you've written an amazing article on histamine. It's in your blog there.
There's a blog. Now
so
I'm
it's
finding
wonderful.
I need a part 2 after this.
Yes,
We've had
definitely.
so
We
much
learned
more
so much
information.
in preparing. And my article will be out in a few days, and it's also on histamine. So we'll have 2 articles on histamine on my website, Corinne Health, CORINNE health.com. So enjoy, and if you go on either of our websites, be prepared to take time, because there's a lot to learn, and it's kind of fun. We really enjoy making it and having it there for you, and we also enjoy talking about it on the radio. So thank you so much. Thank you, Reggie. We'll be back next week.
Bye.